and welcome to this week's episode of the Awanachi Conversations. These are real-life conversations where we discuss different issues around women, and of course, soon to come, we will be inviting different men to come on this podcast as well. I'm your host. My name is Mpunga Chipepo Simukwai. I'm happy that on the podcast today, I will be hosting a doctor, an OBS GYN, as they call it, who will just be sharing with us on issues around diabetes and hypertension. You will agree with me that statistics have shown that there has been a spike, actually an increase in non-communicable diseases. So we thought, as the Awanachi Conversations, considering the number of women that are impacted by the hypertension and diabetes, we could have on this week's podcast Dr. Joyce Sakala. Dr. Joyce, welcome.
Thank you. Thank you for having me.
It's a joy to have you here. I must add that Dr. Joyce is actually one of our writers. She actually writes the women's health segment in the Awanachi magazine. So such a joy to have you here on the Awanachi Conversations.
Thank you, Mpunga. It's my pleasure to be here. And just to say a bit about myself, I'm Dr. Joyce Sakala Mombe. I'm an obstetrician gynecologist based in Lusaka. I practice from UTH, the University Teaching Hospital, Women and Newborn Hospital. And like you said, I'm also the writer for the women's health segment of Awanachi magazine.
Yes.
I'm also president of the Medical Women's Association of Zambia.
Amazing.
I'm also a mother and a wife. Yeah, just a bit about myself.
Amazing. Now, Doc, I did highlight in my opening remarks about how research has shown that there has been an increase in the non-communicable diseases. And we thought, as part of our Awanachi Conversation, we could have you come just to share insights on hypertension, on diabetes. Maybe to set the ball rolling, what is hypertension? What is diabetes?
Thank you, Mpunga. And this is such an important topic for women because, from what we see in practice as a women's doctor. Hypertension is when somebody has blood pressure that measures higher than the acceptable limit. Usually we take the systolic to be 140 or less, and the diastolic to be less than 90. If it goes above, then it's hypertension. Diabetes is when the blood sugar basically is not well controlled. So the parts of the bodies that control blood sugar, like the pancreas, may not be working well, or somehow in the body, the mechanism of sugar control, where insulin and other hormones are produced, are not working well. That is diabetes mellitus. This is an important topic for women because I can tell you now, currently, where I work, for women,
University Teaching Hospital, actually.
I'm with pregnant women. Hypertension actually is like number 2 among the causes of death among pregnant women. So this is a timely topic.
Yeah.
Yeah.
Now, you have highlighted the fact that obviously hypertension is on the increase. How common are both conditions in women, both pregnant and not pregnant, particularly in the Zambian context?
Yeah, so it's quite common. Like I've said, most it's presenting commonly in most women. It's actually one of the most common reasons why women go to seek medical help, and it's also one of the most common reasons why women affected have bad pregnancy outcomes. So pregnant or non-pregnant, most women are presenting with these conditions.
Wow. What could be the factors that are, contributing to the rise in diabetes and hypertension, particularly amongst women?
Yeah, I like the way you put that, factors, because these conditions have no known causes per se, but they are called lifestyle diseases for a reason, because most of the factors that contribute to their rise brought about due to our lifestyle and sometimes genetic predisposition. Lack of exercise. Nowadays, we are in Lusaka, you see a lot of traffic. Most of us are not walking. We park right in front of the door where we're going. So lack of exercise, overweight, obesity. Our diet contributes a lot to being overweight. Diet that comprises of processed foods and highly fatty foods, takeaways which comprise mostly of fries, lack of eating vegetables, all contribute to these conditions. But also, some people are just predisposed genetically. Being black is one of the risk factors. It's also more common in older people. So if you start getting above 55 in a man, or if you're above 65 in a woman, you should start checking yourself regularly, because that's a risk factor. And also, being pregnant is also a risk. Some women will develop diabetes or hypertension just for that duration when they're pregnant. Yeah, and sometimes having chronic conditions like kidney disease can predispose someone to have hypertension because of the mechanisms, how they work in the body. Those are some of the
contributing factors. Now, how does diabetes and hypertension uniquely affect women as compared to men?
Thank you for that. And I'll be biased because I'm an obstetrician. Yeah, so diabetes and hypertension affects women in a unique way, because women have cycles, like monthly cycle, where their hormones they run in a certain way. So, and also they may be in the reproductive age or above the reproductive age group. So when they're during production, if they fall pregnant and they have these conditions, it may even increase their chances of having a bad outcome, pregnancy outcome, or having a bad outcome on themselves, having kidney failure, having a stroke, or having blindness from diabetes or hypertension. Yeah, so these conditions also affect women in that way, because of the biological nature of women, where the biological functions may be affected.
Okay. Now, what are some of the common symptoms of diabetes? You've always talked about the elevated sugar. You've talked about the elevated readings in terms of the hypertension. But what are some of the common symptoms that women should be more aware of? What should they begin to look out for that should indicate to them that they may have to get to the hospital?
So, Mpunga, unfortunately for these conditions, for example, hypertension is called a silent killer, because most of the time one may not have any symptoms at all to trigger them to seek help. Even for diabetes, you may not know that my blood sugar is raised. Although for diabetes, you may see symptoms like drinking lots of water, even waking up at night to drink water. And there's also what we call polyuria, which is urinating frequently. Some people may wake up more than 3 times in a night to go and urinate. That may also make you get suspicious that I may have a problem. Other symptoms may come from some of the causes that may predispose them to these conditions. So, for example, for hypertension, if there's an underlying kidney problem, they may have reduced urine. If they have an underlying hormonal problems, they may have excessive weight. And some of the symptoms for hypertension may also include headaches that may be unexplained, frequent headaches, even dizziness. Unfortunately, for some people, the only symptom they may get is maybe collapsing with a stroke. And when they go to the hospital, then they're checked and they know that, they had this underlying condition of hypertension. So other symptoms may be because of the effects of the disease, eye problems. When you go to the hospital, they check your BP and you find that it's actually caused by eye problems, kidney problems, stroke, even heart failure. May be a result of these conditions, and maybe the first presenting symptom before you know that you have the condition. Yeah.
So, what then should a woman do to ensure that they keep their, sugar levels and their diabetes and hypertension in check? Because you've referred to hypertension, for instance, as a silent killer, and sometimes you may not have any symptoms. You just drop, and now it's becoming more common. You just hear stories, somebody just dropped and they're dead. So what are some of the measures a woman just needs to take in order to just take care of themselves a bit more better?
You have to take precautions first, not to have this condition develop. We may be genetically predisposed, but usually you need like a second hit, something that should push you off the cliff to develop that condition. Even if you have the genetic predisposition, our lifestyle needs to be in check. Yeah. We need to exercise. We need to deliberately have a healthy diet. That has a lot of implication on our weight. Most people may be exercising, trying to lose weight, but afterwards you take a large meal or you drink the sodas and all that. That may not work. So watching the diet and also having a regular screening. Once in a while, it's good to just go and have a health check, at least 6 months or at least within a year. Just to, when you go, that would be the obvious thing that will be done, checking your blood pressure and even screening for diabetes. If you know you have a family history, you know that somebody in your family had this condition, it's even more important for you to check yourself regularly so that you catch it early. But more so importantly, you need to modify your lifestyle, avoid alcohol, avoid smoking, and avoid excessive weight to avoid these conditions.
Okay. Now, how does pregnancy impact the risk and management of the two conditions, diabetes and hypertension, in women?
I'm happy to talk about that.
For obvious reasons.
Yeah, so so like I alluded to earlier, pregnancy affects diabetes or hypertension, and also hypertension has an effect on the pregnancy. So what do I mean? Some women may have exacerbation of they may develop raised blood pressure just because they're pregnant, because of the interplay of the hormones in the body due to pregnancy. And also some women will develop diabetes just because of the hormones, the way they play in the body during pregnancy. But also when somebody is pregnant, the diabetes or hypertension may have an effect on the mother and on the baby. What can this be? On the baby, hypertension may lead to reduced growth, while in the uterus they may not grow as well as they should. They may be predisposed to premature delivery if the hypertension or diabetes hypertension becomes excessive and dangerous for the mother. They may be delivered prematurely and may have less chances of survival. On the mother, the hypertension has all those effects I talked about. It can affect your heart, your brain, the kidneys. So you can develop kidney failure. There's a condition that we call preeclampsia, which is when the hypertension is associated now with kidney problems, where you start seeing protein in kidneys and even kidney failure. You may have a stroke. One may even have heart failure. And after pregnancy, this condition may even not go away, even if it just showed up during pregnancy. Diabetes affects the baby in many ways. Some women have recurrent miscarriages unknowingly because of diabetes, which is not controlled. If it's not controlled, the baby gets affected in terms of congenital anomalies. They just get deformed in the uterus. The heart has holes, or the back has a problem. They have spine problems. Yeah, and sometimes the baby may just demise in the uterus because of the upswings in the sugar levels and the hypertension.
Okay. You have talked about hypertension in hypertension and diabetes in pregnant women. Now, what are the potential complications of unmanaged diabetes and hypertension in women? Generally, yes.
Yeah, so in women generally, these things, both diabetes and hypertension, can affect your eyes, your heart, your brain, and your kidneys. And for diabetes, even the nerves, the peripheral nerves. So somebody may just have abnormal sensation or reduced sensation in the nerves. They may have a wound, but may not know that they have a wound, ulcers which may not heal because you're not able to feel it. So we even prescribe like special shoes so that they're able to protect their feet from injury, which they may not feel, and somebody gets an ulcer that is becomes dangerous. Kidney failure may result from the lack of control of blood sugar and blood pressure. Equally, eyes may get affected, and the brain, one may end up with a stroke, because of both conditions. Yeah.
Now, in terms of the Zambian context, are you able to give us the age group that is mostly affected by both conditions, diabetes and hypertension?
Yeah, so like I said...
Sorry, would you like some water?
Yes, please.
Yeah. Eric, sorry, we need some water. Which one is even the water?
Okay.
She needs to...
That's okay.
I can...
That's fine.
No starting from the top, no shiny
I'm starting
intro.
from the
Okay,
top.
thanks.
You okay?
Yes, thank you. So, like I said before, advanced age is a risk. So men above 65, women above 65, men above 55 years. However, we are seeing more and more of these in younger people now because the risks that we mentioned, obesity is increasing in younger people. Younger people now are having the same lifestyle that would predispose people to these conditions. Having excessive fat around the tummy, especially for women, predisposes to these conditions. So even younger people are getting more and more of these conditions because of the way of lifestyles have evolved over time.
When you say younger people, like what's the age?
20,
21, 35, 30?
Younger people, but also if you go to the children's hospital, you find the whole world with a lot of children who are hypertensive, diabetic, for different reasons, genetic predisposition, and
how do you deal with a newborn or a baby that's hypertensive? And
well, not usually a newborn. You could tell. It can be for different reasons. Maybe they have an anomaly, maybe a heart problem.
Okay.
Yes. And for children, the younger children, like the toddlers, maybe they are genetically predisposed
to diabetes.
Yes.
So they get it that
early.
That mean they have it the rest of their lives?
Yeah. So they go to school, you teach them how to inject themselves, you teach them how to live with it. And
how common is that?
It's common. It's common. I may not have the figures.
The actual figures,
yeah.
Okay. Wow. Okay. That must be quite a challenge, but I'm happy to hear there's some ways that it can be managed.
Yeah, so so there are different ways of managing these conditions. Obviously, modifying our lifestyle is number one. The diet has to change, but it's even better if we adopt that diet before we are diagnosed. Yeah, but you have to change your diet. One has to start exercising if they are not, quit smoking, quit alcohol, and quit the processed foods. If it's for diabetes, it's even like a strict diet where you have to even follow the timeline so that it coincides well with the uptake of the medication, so that your blood sugar doesn't swing around, which can affect your organs, which I alluded to earlier. So there are also different drugs, and luckily now there are newer drugs that one may not maybe need to take once a day. Initially, there were no drugs that you could inject like once a day for diabetes, but now they're available. So they're becoming easier to manage, and there are newer drugs with less side effects. So if you improve your lifestyle, the control may be better and the drugs may become less needed, or you may need only a fewer drugs than before. Yeah.
Somebody once said that actually health and fitness, or living a healthy lifestyle, is 80% of your diet and the exercise is just 20%. So really, like, I like the fact that you're emphasizing on the importance of a healthy diet, on the importance of exercise, because that is what that 80-20 principle is essentially about. But you find a lot of us as women particularly, we are busy. Your day starts off very early and you end your day very late at night, and then during the course of that day you are so busy doing so many things that you're not particularly paying attention in terms of what sort of food you're eating. You're not even paying attention to exercise because you think, oh my goodness, exercise is just a lot of work. There are people who hate exercise. They will even tell you, like, look, for me exercise just feels like it's a punishment. What would be your word of encouragement to a woman like that?
So sorry. Yeah, so I think it's important as women to take care of ourselves, because we take care of families. We're the pillars of our families, and if our health deteriorates, then the whole family suffers. So I mean, simple things like taking a walk, a deliberate walk, sprinting. I know sometimes you may be so busy, you feel like, okay, I've done enough exercise in my
in my chores.
But exercise has to be deliberate, because you need to work out the heart muscles, tone your body. Yeah, so you can start small with maybe a walk. As your body develops more endurance, you even start pushing yourself further without much the way this goes. Stress,
without much stress. That's a better approach. I always tell myself that I consider myself as a health and fitness enthusiast, and I always tell myself that God has given us 24 hours. Honestly, in that 24 hours, you can just take out 30 minutes, even if it means you walking around the yard, even if it means you taking a lunchtime walk, even if it means you telling yourself, okay, when I get closer to home, I'll probably, on my way home, I'll get a yango and then drop off at that point and then walk. Already that is the little efforts that we can incorporate into our daily lives.
And even in the homes, I mean, there are more innovative things. Like you can have a routine done in your home. You can have a skipping rope. There's skipping rope, Zumba. You can have it in front of your TV.
Do some dancing.
And do it with your kids as a morning routine. So we can be innovative, because I know as women are very busy. But if I want to talk about a bit about that, because as women we also control our family's diet. Absolutely. We're the ones who decide what our children should pack for school, what our partners will eat at home. So when people hear that, they think maybe it's fries or just the carbonated drinks, but even the portions that we eat, the portions of shima, because that's a lot of carbohydrates. That's a lot of carbohydrates to eat, and then maybe you're just delegating a lot of things and you're eating a lot of shima. That's a lot of carbs, and you'll be surprised, like, I eat clean, I eat shima, I only eat shima, I don't eat fries, but that's a lot of carbohydrates. So we need to increase on the vegetable intake, more vegetables, more fruits, more protein, and less carbs.
But you see, Doc, I will tell you in all honesty, I think the nicest food group is carbs. You know, like if you don't eat carbs, you just feel like it's not quite. And then you have people say like they can't do 1 lump of nshima. It has to be 2 for them to just feel that they've had a good meal. Maybe you just need to speak to us. So how do we change that mindset? Because like I'm saying, if you haven't had that 2 lumps of nshima, you just feel like I haven't quite eaten today.
Yeah.
You know, how do we work towards changing our mindset and you know, adapting more healthier eating
Yeah,
habits?
I like the way of putting it, adapting, because that is learned over time. Like, babies are not born eating whatever they eat. We have to force them sometimes to learn to eat what they eat. So it's learning, teaching yourself, and also if you are eating less processed foods, you should try eating roller meal and eating white mealie meal. You find that you eat less and get full with the less processed foods like roller meal. You start eating less. You get full faster when you're eating the less processed foods. So that's one of the steps you can take. And that is the diet that we even prescribe for people that develop these lifestyle diseases. Yeah, so it's just a matter of training ourselves. Even the amount of nshima you eat, if you start eating less, even your stomach will adapt. It will become smaller. Yes. So
the opposite is true. When you're eating a lot,
it's a muscle, so it stretches. Yeah.
Yeah. Wow.
Yeah.
Okay. Now, how can women effectively manage stress to lower the risk of diabetes and hypertension? Like we've highlighted, women, there's so much demand. There's demand in our workplaces, there's demand in our families, there's demand in our social spaces. How can we effectively manage stress in order to lower the risk of diabetes and hypertension?
Thank you. I think that question depends on maybe individualized every woman. So women are stressed for different reasons. They have so much to do, so many things to take care of in the Zambian context. That this may predispose them to mental health issues. And also when they're in that constant flight mode, certain hormones are released, which may predispose you to have high blood pressure. So I think it's important to know your limits, and it's important to get help, accept the help that is available. There's machines that are available nowadays. You can have a washing machine, have a
Those things, please.
I mean, because some of us would be like, no, I don't want anyone to cook for me. But if there's a great, a cook that you can hire, a house help that can cook well, why not remove that sometimes from your to-do lists? Washing, ironing, if you're able to use certain things, certain equipment and certain help. Even taking care of the families, there's a lot of family members that may be willing to help. So I think for women, we need to take care of our health, and sometimes I want to put it in a nice way, not take on too much on ourselves, even when the help is available. Yeah. And also sometimes we need to learn to say no to certain things that if our plate is full. So that we don't burn out, because it's only when we're healthy physically and mentally that we can take care of our business and our families.
Absolutely. Now, Doc, probably as we are winding down our conversation, what innovations or medical treatment is available to women that may be living with diabetes and hypertension, particularly in the Zambian context? What sort of interventions are available currently?
So in terms of interventions, I spoke earlier about newer drugs. Before, the drugs would give somebody a high pill burden, like taking so many pills in a day, and maybe certain side effects which were undesirable. But now there are newer drugs for both conditions. And also when somebody develops a complication like heart disease, we have a whole hospital dedicated to heart health, where they can do management of complicated cases. You can even have open heart surgery, and even kidney transplant if your kidney is affected. is available in Zambia. Yeah, so there are a number of advances that are being offered at the moment in the country.
Okay, so Dr. Joyce, it's been a joy. It's been a pleasure having you on the program. But before I let you go, what would be your final word to women that are watching? Some of them probably scared to go for that screening to check if they have diabetes or hypertension, or those that may be living with the condition. What would be your word to women like that, and the other women generally?
Thank you, Mpunga. It's been a joy. So firstly, let me applaud women. I think women are very good at seeking help. When they know they have any condition and they have medication prescribed, they'll take it religiously and even encourage the family members to do so. So I applaud women and urge them on with good health-seeking behavior. I encourage women to adopt healthy lifestyles for their families. When you adopt a healthy lifestyle for yourself, we have a lot of influence as women on our families. The diet that the family takes, if you start exercising, your children may start joining you, and they may also follow the same diet, because most likely we decide what everybody eats, and this may lessen their predisposition to these lifestyle diseases from a very young age. Yeah, so I encourage women to look out for their health, take care of themselves, take care of their mental health, avoid stress, and take care of their families.
Okay. Thank you so much, Doc. Thank you so much for coming through to the conversations. We look forward to having you discuss, obviously, another health topic, even as you continue to do the amazing work that you do on Awanachi as our women's health contributor. So we look forward to hosting you even in future conversations as well.
Thank you. It's been a pleasure, and thank you for having me.
Okay. All right, there you have it. I've been talking to Dr. Joyce Sakala. She's an OBS GYN. She was just delving into the issues of diabetes and hypertension, which as you may be aware, there has been an increase in these non-communicable diseases. So we thought we'd look at this perspective, particularly on how these two conditions affect women. I've been your host, Mpunga Chipepo Simukwai. Do join me on the next episode. It's goodbye and God bless you.